For cash quizzes and info on managing your money, visit lifenetwork.ca.
Hi, I'm Deborah Kelly. Welcome to Diagnosis MD. Today's topics are melatonin, keloid scars, tanning beds and cancer, varicose veins, and preventing wrinkles. Joining us today are Dr. Lisa Kellett, a dermatologist, Dr. Martie Gidon, a dermatologist, and Dr. Daniel Schachter, also a dermatologist. Our first topic today is melatonin. In tests on both rats and mice, melatonin caused a significant 20% increase in their lifespan. Melatonin can reverse the decline in sexuality with aging and can also be used to treat insomnia. It can also be taken to prevent jet lag. You know, when we think of melatonin, Lisa, one of the things is people who travel, they like to use melatonin, but there hasn't been a lot of studies and research to sort of indicate its safety.
That's correct. Melatonin is a synthetic hormone that is made for a number of treatments, one of which is jet lag. Some people say it's helpful with sleep. It is also made by our body. It's an endogenous hormone, but it's very controversial as to what exactly its effects would be when taken as a synthetic hormone.
Yes, and I think, Martie, too, one of the things is, as Lisa mentioned, you know, it is a hormone made in our bodies, made by the pineal gland, which is at the front part of the brain, but that's a natural hormone, whereas the one that we're buying over the counter, it's synthetic or animal.
That's right, and you never really know what you are getting. It is not available in Canada, and some people will go to the U.S. to buy it, but you really don't know what you're getting. Same as with any medication that you get with herbs in it, different chemicals. You really don't know what is in it, so you really should be very careful with what you're taking.
And of course, when melatonin rises in our natural bodies, Daniel, then it's sort of a trigger to tell us that it's time to go to sleep, isn't it?
Yes, there's a diurnal or a daytime variation where it will go up and go down, and if people are taking synthetic melatonin, they may be altering, or this is what they're trying to do, they're altering the variation. They're trying to change the sleep pattern, and this may be how it works with jet lag. Again, it is controversial, and hormone specialists or endocrinologists are in disagreement about whether melatonin can really do what it's claimed to do.
And of course, I think another thing we have to say, Lisa, is, you know, maybe it's not available here, but nowadays with the internet, so, you know, I guess at the end of our fingertips, that you have to be wary of anything that you're purchasing.
Absolutely. The bottom line is to be very careful about what you're getting.
The other thing, Lisa, too, I think is a big concern is that when we look at studies, you know, some studies have said with melatonin that it actually can decrease depression or increase depression, and same with fatigue. Is that, you know, who are these studies done on and what do they mean?
In general, it's very difficult to apply studies that involve small numbers of people to the general population at large.
And I guess we can say that for just about everything.
That's correct. The best studies to look at are those that are randomized and double-blinded studies.
And of course, Daniel, too, some of the problems nowadays with studies is that, you know, whether it's prostate cancer or melatonin or across the board, it depends on where you live, what country you're from, diet, everything plays a role, doesn't it?
Absolutely. Also, we should look at the center where the study is carried out and how large a study, how many people were looked at to make it a viable study.
Another problem, I think, Martie, that we have to consider is the fact that we're all looking for quick fixes. And maybe if we just did some natural preventative things, we wouldn't have these problems.
That's right. Rather than taking a pill, you should consider planning for your trip. So make sure you have enough rest before starting your trip, and avoid drinking alcohol when you fly especially, and drink lots of water, and you'll just feel better all around.
Travelers who suffer jet lag and people suffering from mild sleep disorders benefit the most from taking melatonin. A great night's sleep does wonders for the skin.
was outrageous in that gown. She was breaking every rule in the book.
She was just a total glamazon.
They've come so far.
This dress is
Style star. Follow their rise to fashion icon.
Effortlessly elegant.
Stylish fashion sense.
It looks fantastic on her.
All out, movie star, glamour queen.
Style star. Style star. Today at noon, after House and Home on Life Network.
PharmaSave knows sometimes you just need a little nighttime comfort. We're here to support you with warming herbal tea, perfect sleep accessories, and soothing night creams. Because when it comes to your wellness, we care. One stop, one goal to help you live well.
Live well with PharmaSave.
If you're looking for smart mealtime solutions, we have just what you're looking for. Hi, I'm Charlotte Empey, editor of Canadian Living magazine. We serve up dozens of delicious you-can-do-it recipes in every issue. All our recipes are tested till perfect in our kitchen, so they'll turn out perfectly in yours.
And don't forget to watch Canadian Living Cooks.
Your life, good, better, best. Find out how to fill every day with joy in our April issue on newsstands now.
Hey, everybody! Look what's going on at Blockbuster! Hey!
You may find it hard to contain yourself, too. Because right now at Blockbuster, there are two great ways to bring home the laugh-out-loud comedy, Cheaper by the Dozen, starring Steve Martin. Rent Cheaper by the Dozen and keep it for 2 full nights. Or buy it on DVD. So rent it or buy it and make it a Blockbuster night.
Can I help you with something? Yeah, I'm here to skate.
You skate?
Stuff.
Our second topic today is keloid scars. Keloid scars grow slowly and can reach 5 or more centimeters across. They tend to be much more common on the neck and the chest. Keloids occur most often in heavily pigmented people and tend to get progressively worse. Now, I was reading about studies that are actually using non-steroidal anti-inflammatory drugs with arthritis, and they're saying now it might help with keloids, Daniel?
There is some evidence that this may be true, but really the best studies show that a local or topical cream called imiquimod can be used to treat keloids, especially when they're freshly developing after a wound, or if a keloid is ever removed, then in the healing period the imiquimod cream is used and it may reduce or prevent the development of keloid.
Now, sometimes when you're actually developing a scar, it can itch, but I would think that if you actually are itching it, you're probably going to irritate it more, Lisa.
Well, the important thing is not only not to itch it, but also to prevent infection, because an infection can actually spread the scar and make it bigger.
And what about peels? I mean, will peels ever help with the keloid scars?
You know, in general, the peels just aren't deep enough. They'll treat the superficial skin, but not deep enough. With respect to treatment, there are some good treatments available. They include intralesional and steroid injections, which is a needle, and it's injected into the keloid itself. In addition, I've used laser treatment, particularly the pulse dye laser, to treat keloids with very good results.
Now, if you're actually prone to a keloid scarring, Martie, does that mean every time there's an injury, you're probably going to have one?
Possibly, yes. We don't really know why certain people will develop keloids, and sometimes it's the tiniest trauma. Sometimes just a tiny pimple will lead to a huge keloid that can be very disfiguring, and especially on the chest and back, in many people, they can develop.
And why would you say that they develop more, say, there than on the leg or something?
Some areas, of the body have skin that's a little bit more fibrous, and you're more prone to developing worse scars in those areas. Even in people who don't develop keloids, they can develop what's called a hypertrophic scar, which is just a thickened scar if they have, say, a mole or some skin lesion removed. And the upper body, the upper arms, the chest, and the back tend to be areas where the skin is more fibrous, and you're just more likely to develop larger scars in these areas.
And is plastic surgery ever a good idea, Daniel?
Sometimes there are keloids that are almost hanging. They're not broad-based. They, like from the earlobe, they may be hanging down. And I think in this case, keloid can be excised or even removed by a laser. Again, whenever you do surgery or even laser surgery to remove a keloid, you have to do something with the base to prevent it from coming back. And that can either be imiquimod cream, injection of cortisone into the area, or possibly the pulse dye laser, the V-beam laser.
Another important point to add is that they've actually done studies that have shown that at excision, if you're excising a keloid, it's a good idea to actually inject the keloid at the time of excision to decrease the formation of a new keloid.
Right, of course, because if you're removing a scar, what's to guarantee you're not going to create another scar?
That's right.
Heavy scarring is more likely to form when the wound is closed under tension or where there is an infection or bleeding after surgery. If a foreign body is present in the wound, as is possible after an accident, keloids will be more likely. Our next topic is tanning beds and cancer. Research indicates that sunbed users who are less than 30 years old and tan more than 10 times a year are 8 times more likely to develop malignant melanoma, the deadliest form of skin cancer. Studies have shown that just 10 tanning bed sessions cause changes in skin cells, which are thought to be essential in the development of skin cancer. A tan is evidence of skin damage from exposure to ultraviolet UV radiation. Martie, do you think that part of the reason people don't sort of pay attention to the fact that tanning beds are dangerous is because it's not an immediate response? You know, with a cold, you got a runny nose, you have to lie down, or the flu. This is something that is going to happen later on.
Right. Well, first of all, there's a myth that tanning beds are harmless. And of course that's not true. We know that it's mainly UVA that you get from a tanning bed, and UVA causes deeper damage into the skin. And of course it causes skin cancer, but UVA can also stand for aging, and it does age the skin, and you do develop brown spots and wrinkles, and especially the younger people who do go to tanning salons, they really can't relate to skin cancer at their age. But when I tell them you'll have brown spots and freckles and wrinkles, they listen a little more.
Less elasticity as well in the skin. And of course, you know, aside from melanoma, which is extremely dangerous, there are 2 other types of skin cancer. Lisa, maybe you can talk about basal cell and squamous cell.
The most common type is something called basal cell carcinoma, and that has been estimated to occur in about 1 in 5 people in their lifetime. That, thankfully, is very treatable if found early, and the treatment of that is basically excision or cutting it out. The other kind is something called a squamous cell carcinoma, and that is maybe more aggressive than a basal cell carcinoma, but once again, if found early, it's treatable by excision.
And let's just go back to those tanning beds for a minute, Daniel. What if you're, you know, overexposed, you stay in too long and you burn? That's far more dangerous than sitting in the sun.
I like to think of it as being equivalent to sitting in the sun. So a burn is a burn. A tanning bed is not safer. It's not more dangerous. You have to be careful. You have to prevent damage to the sun, from sun. So a tan is actually damage to the skin. So whenever you go in the sun or in a tanning booth and you get a tan, you're damaging, you're increasing your risk of skin cancer and aging. If you get a blistering sunburn, any time in your life, it doubles your lifetime risk of developing a skin cancer at a later date.
further to Danny's point, in fact, UVA rays that are used in sun tanning beds cause redness later on. UVB rays cause redness more immediately than UVA rays. So when you go out in the sun and you see that you're getting red, you would go inside. However, when you're in a sun tanning bed, it takes you longer to develop that redness. You may actually stay in there longer and then thus develop more ramifications of UVA exposure in the future.
And people think that going to a tanning bed and getting a base tan before going south is a good idea, and it actually just enhances the risk of skin cancer.
Right, so they think they're doing, you know, something good for their skin, and essentially they're not.
That's right.
We also have to remember that when you go into a tanning booth, you must protect your eyes. You shouldn't go into a tanning booth, but if one is ever there or out in the sun, you should wear sunglasses or protective eyewear, because there's also damage to the eyes. You get early cataracts and the aging of the eyes as well as skin.
And of course, that's the thinnest area of skin anyways. I mean, I think it's the, you know, thickness of an eggshell. So we're talking about a very delicate area. Lisa, you were going to say something?
I was going to say, if people like the appearance of a tan, there are some self-tanners on the market that are quite good now, which contain something called dihydroxyacetone. And by using them, you can have the appearance of a tan, but not by not going out in the sun, you don't have the risk of UVA or UVB exposure.
Daniel?
In fact, in Toronto, there now are institutions where you can go and have it sprayed on. And you, like going into a car wash, you get the self-tanner sprayed on. It takes basically 2 minutes, and you go once a week. It's a stain on the skin. It's not dangerous.
Right, and then you can have that healthy glow without exposing your skin to the dangers of UVB rays.
Right. Now, that self-tanning does not protect you from the sun, so that's important for people to know as well.
Right, of course, so that they definitely still have to go outside with their SPF on. Tanning beds are a great way to look a little healthier during those long winter months, but the truth is that the higher the number of exposures to a tanning bed, the greater the chances that an individual's skin may not be able to perfectly correct the damage done each time, placing the tanner at an increased risk of cancer.
Saturdays on Life Network.
It's very exciting.
Get all the celebrity info you can handle.
I like sugar.
And here's some fun extra info in a whole hour of star power.
Now it's time for reality. I'm innocent.
That's part of what makes us who we are.
Who am I?
That's what we do. We joke.
Hey, Extra, thanks for visiting. We'll see you later.
This news can't wait till Monday. Extra, Saturdays at 1 after Trading Places on Life Network.
If you saw a horrible tragedy, wouldn't you call for help? I'm Charlize Theron, and I need your help right now. In Asia, baby bears only a few months old are taken from their homes. Ropes are pulled through holes piercing their muzzles, leaving sores that won't heal. Their paws are burned on hot plates as cruel handlers pull on their chains. Moaning in pain, they dance for tourists who pay to take their picture. And to think, this is just one of the ways bears and other animals around the world are suffering this very moment. It breaks my heart to know animals suffer like this. We can't ignore their cries for help anymore. That's why I made the decision to do something. I joined WISPA, the World Society for the Protection of Animals. For years, the people of WISPA have dedicated their lives to rescue and care for suffering animals like these dancing bears. But WISPA can't help them alone. They need support from concerned animal lovers. Someone like you. Please, pick up the phone right now and call to become a WISPA animal rescuer. For only $16 a month, you can help save animals and rescue them from a life of suffering. Your gifts can provide medical care for an abused bear, feed an abandoned dog safe from the streets, or provide shelter for a rescued chimpanzee. As an animal rescuer, you'll get our WISPA newsletter and an update each month about recent animal rescues. Rescues that were made possible with your help. In your hands is a powerful weapon, a way to fight cruelty and defend our fellow creatures. You've seen their horrible suffering. Now is the time for you to act. Don't sit by and let the torture and abuse continue. The power to stop it is in your hands. Please, call WISPA now.
Our next topic is varicose veins. Varicose veins are more likely to develop in women than men. Hormonal changes that occur during pregnancy can increase the likelihood that veins will become swollen and bulge. A factor making varicose veins more likely includes being 20% over normal body weight. If varicose veins get very bad, they can cause ulcers on the ankles. And of course, varicose veins for a lot of women are unsightly, and that's part of the problem, and they can throb as well.
That's right. There are a number of treatments available for varicose veins. The best way to start treating is to diagnose it correctly. And there are basically two venous systems in the leg, a deep venous system and a superficial one. What you need to do is to get a duplex ultrasound, which is an examination of what exactly the problem is. If the deep veins are leaking in the leg, then fixing the superficial ones will do nothing because you haven't fixed the problem. So what you have to do is do a good diagnostic assessment. If the deep ones are leaking, there's a new procedure called endoluminal venous closure. And what that does is it threads a catheter up inside the vein, fires it inside the vein like a laser, and closes off that deep vein and stops it from leaking. And that will soon replace stripping, so that there's a very, very small scar as opposed to multiple scars down the leg. Then you can treat the superficial veins, and that would include things like sclerotherapy and now our new techniques such as laser.
And as we get older, our veins sort of lose that elasticity. But why is that? And why do they get bigger and swell?
Well, veins have valves in them, and they're one-way valves. And as the veins extend, the valves become leaky, so you get backflow of the blood, and that causes distension of the veins. And certainly hormonal
factors. Of course, then they're not getting oxygen, right? The blood isn't.
Right. You have pooling. So and there's backflow, so that you have pooling in the lower leg, and you can actually develop swelling of your ankles, different rashes, as was mentioned before. But hormones can play a role in causing the valves to become leaky, and also weight gain during pregnancy when you have the weight of the fetus pressing on the veins, and certainly your heredity takes a part as well.
Aside, Daniel, say from every chance you get raising your feet above your head, what other things can people do?
I think that they should try and lose weight and do proper exercise, and certainly they can wear support hose. For men, this can be support hose that are knee highs, and for women, support pantyhose.
Martie?
And support hose just are so important in someone who has varicose veins, and a lot of women in particular will come in and tell me that they are so ugly there's no way they're going to wear them. But support hose now come in fashion colors. They have nice textures. There are more sheer ones and certainly more opaque ones that look like tights, and they can have a full pantyhose. You can have a control waist. You can have support knee highs, which are tight at the ankle and loose on top so they don't constrict the blood vessels. So there are so many choices. There's really no excuse to not wear them.
Now, what about when varicose veins are a sign of a much more serious problem, Lisa?
Well, varicose veins can also be a sign of a vascular problem, so that's why it's so important to get an assessment. You can actually get quite a bit of pain and ulceration from varicose veins, and it's important for people to know that you don't have to suffer in pain, that there are a number of treatments available, and they're not as painful as they once were.
Varicose veins are a common problem in North America. Regardless of their cosmetic drawbacks, varicose veins can signal circulatory and other health problems, and therefore always need to be shown to a healthcare professional.
Olivieri, a fresh take on tradition. Discover our fresh pasta and sauce.
Introducing Crest Whitening Expressions Cinnamon Rush. Bam! A bold blast of cinnamon that keeps your taste buds tingling.
Bam.
The whitening won't surprise you, but the taste will.
I'm so proud being the reactant man, helping people relieve their allergy symptoms. Like Dave Gibb, couldn't go near ragweed and grass. Till now. And look at Al Gray. Cats and dogs used to put him in a tizzy. Not anymore. Ah, Bev Ritz. She'd cringe with fear when you mentioned pollen. Look at Bev now.
More and more Canadians are happy they chose Reactant. Call 1-877-REACTANT for a trial offer. Relief can really feel good.
Got plans? Big or small? Bring them to any one of more than 400 Home Building Center locations. We help turn plans into jobs well done. Home Building Center, we've got your lumber and everything else you need.
Bailey's. Let your senses guide you to a sensuous experience. Visit showcase.ca.
Our final topic is preventing wrinkles. Exposure to ultraviolet light, UVA or UVB, from sunlight accounts for 90% of the symptoms of premature skin aging, including wrinkles. Researchers with the Nurses' Health Study say that moderate exercise for 7 hours a week was associated with 70% fewer wrinkles. And of course, you know, things like gaining weight and then losing weight very quickly can cause sagging skin and problems, you know, SPF. There's 100 things we can do, Daniel.
I agree with you in that this is a genetic problem, in that blondes and redheads, people with fair skin and blue eyes really tend to burn, and they're much more at risk of early wrinkling and early aging. One has to definitely watch your sun exposure, use sunscreens all the time. Sun avoidance is very important. The more sun you get, the more you're going to age. There are also many, many topical treatments for sun damage and wrinkling. There are things from Retin-A and all the Retin-A-like products, vitamin C-like products, etc., that can be used topically. And then there are many much more aggressive things that can be done for wrinkling, such as peels and even laser resurfacing.
Right, and of course, even, you know, things like educating our children at an early age, Lisa, so that they understand, you know, to take care of themselves. Long sleeves, hats, you know, sunglasses.
Absolutely. The other thing that is new these days is something called the free radical theory of aging. And what that says is basically that if you can decrease the effect of free radicals using things like antioxidants, you can actually decrease the damage to the cells that sunlight does. And some of these antioxidants would include things like vitamin C, vitamin E. There's something new called alpha-lipoic acid, which is thought to be a very powerful antioxidant.
We should also mention smoking, because smoking does cause wrinkling and yellow discoloration of the skin and really increases the effects of damage on the skin with the sun.
Right, and what about alcohol then too? I guess that's something also in moderation that should be
that's right.
avoided.
Absolutely, and then in terms of general nutrition, the better your nutrition is, the better you are to be able to repair cellular damage.
Drinking lots of water every day will keep you hydrated and help your skin stay moist and smooth. Water is a key ingredient to youthful skin. Thanks to all the healthcare professionals who appeared on today's program for providing their invaluable advice and insight into the problems facing medicine today. If you have any questions or concerns about these or any other medical topics, consult your doctor. That's it for today. I'm Deborah Kelly, and we'll see you next time on Diagnosis MD.
You're watching Life Network, an Alliance Atlantis network.